Last week.
It's been a long week, hold on. Yes, okay. What did you guys do? Huh? How about over here? What'd you guys do? Yeah. Oh, the unfolding care plan, you started working with it. Very good. And? What's it?
The whole care plan, except,
Wow.
She has like 100 questions. Yeah, I say that. Somebody's questions. No, she said she's gonna show me. Well, I was asking, nobody told me. I talk about it. I only know about the ones that I showed you. Yeah. Because I was asking them.
What about over here? What'd you guys do in clinical? Hello? First row. What'd you do in clinical?
Same thing, we were on the same team. We did the unfolded plans, yeah.
Okay, all right, so today we're going to talk a little bit about hygiene and skin assessment. We teach until the end of the day, okay, so you know, so we will not be meeting faculty-wise to discuss the exam until after 5, okay? So, relax, take a deep breath. It's over, it's done, right? And we'll see how everybody did, and we'll take the courses offline, and we'll post the grades. Okay? Good, fair enough. All right. So, hygiene and skin assessment. This is actually a task that many, many times is delegated from the RN to the LPN, maybe to the CNA. But why is this something that we, as the RN, should be concerned about?
for any skin integrity.
Okay, pressure ulcers, a breach in skin integrity, and why is something like that important?
It could be a start of something really.
Right, that could be a very, very, very big deal, right? So even though we may delegate part of the task to the CNAs or someone else, remember what I said before, anything with delegation, ultimately, you're in charge, right? So ultimately, it's going to be your responsibility. Okay, so if you give everything away and don't follow up to see if it was done, if it was done the way it's supposed to be done according to the policies and procedures, and if maybe there's a change and the individual, for whatever reason, does not follow up with you, and you don't follow up, who's gonna be really responsible? Us. It's always gonna be us, okay? So what I used to do, especially as a new nurse, I would, parcel out my assignment according to what the other nurses were doing and according to the staffing and how many CNAs were on the floor. And I would always tell the CNA that I was working with, when you go in to wash up, so Mr. So-and-so, Miss So-and-so, call me and we'll do it together. And that's exactly what we did, okay? 2 people doing the work, it would go by much faster, okay? And I got to do my assessment according to what I needed to do, right? I got to listen to my lungs, I got to do my skin assessment, I got to turn my patient, so I saw everything that was going on, right? What's the third benefit of doing it together?
Safety.
Safety, excellent point. What's another one? Learning experience. Huh?
You get the time, more time.
Time to do other things. What else? How about teamwork? Camaraderie. All right, camaraderie. I count on my CNA, but my CNA knows that they can count on me as the RN. So overall, it's very beneficial as long as everybody is doing what they're supposed to be doing. Okay, so you've been to your site a couple of times, enough so that you've been able to see some of your patients. Has anybody actually had the experience of washing anybody? Not yet?
In my
Okay.
clinicals, I observed.
You observed?
Yeah.
Very good.
CNA washing a few patients.
Okay, very nice. Anybody else get an opportunity to observe?
Yeah, we
You
saw.
did? Okay, very good. So hopefully after today, you can participate a little bit in doing that. So when we are setting someone up or we are getting ready to bathe them, there's a couple of things that we need to take into consideration, okay? One obviously is the status of our patient, right? Is the patient awake, alert, responsive, okay? Do they understand when we give them instructions, right? If I'm coming in with some fresh sheets and a gown and I'm starting to take out some of their toiletries, and I say, we're gonna, get you freshened up, get you washed up, out of bed, blah, blah, blah. Are they understanding, okay? Because you will have some patients, either in the facilities that you're in now or in the hospital, where maybe they don't want to freshen up or get washed at the time that you say you want them to do it, okay? Remember, it's all about a give and take with your patients. So if they say, no, I don't want to wash up now, I usually take my care at 4 o'clock in the afternoon. Maybe people have a different schedule, right? Some people like to take a full shower or a bath before they go to bed. It helps relax them when they go to sleep. So if that was the case, what do you think you would do as the nurse?
Talk to the next shift nurse and ask her.
Okay, that's a great idea, right? So we're looking, perhaps, if at all possible, can we accommodate the patient, right? They don't have to do everything that we want them to do when we say we want them to do it. We do have some flexibility, so maybe the evening shift, or you could do it later in the day if you're still on, can be in charge of that patient's hygienic needs. You can just do the bare necessities. And you would take one of their patients that they would normally wash up in the evening. Does that make sense? Okay, and again, equal division of labor makes for much better staff interactions. Okay, so we assess our patient. Obviously, we're always going to provide privacy. We're always going to provide comfort. And if we say that the patient is self-care, what does that mean?
Take care from themselves.
Made themselves.
They can do everything by themselves, okay? If they're ambulatory, maybe we can even show them the shower, okay? And they can go take a shower. What about if they're partial care?
They need help.
They need assistance, okay? So partial care is tricky because sometimes some people might feel it's faster if they do it themselves and they wash the patient up because maybe the patient takes too long. Sometimes they do take a long time. But the idea behind it is you really need to let them do it themselves.
Yeah.
Okay. It promotes a lot of independence, it prevents depression, and even if it takes a while, you know, even if you're recuperating from some kind of surgery, or maybe they had a stroke, let them do it. Let them do it. You might have to change the water a couple of times, you might have to set them up a little bit earlier, if you want them to brush their teeth and wash their face before breakfast comes. So then you give it to them earlier, that's all. Try your best to accommodate. Okay, so that's partial. And what about if somebody is a complete care? Complete.
You have to do everything.
You have to do everything, okay, for whatever the reason. The patient is unconscious, the patient can't move, whether it's permanent or temporary, we have to do everything. AM care, what does that term mean?
Morning.
Morning, right, and PM care is evening care, and what is PRN care? As needed, right, as needed. So maybe I gave my patient a bath, but then my patient soiled the bed, so I'm gonna give him, I don't know, partial care or something, whatever the case may be, right? So that's as needed. Okay, so inside we're gonna show you how to, you know, set up the basin and everything. So you'll be able to do that. And a lot of times, I will tell you guys before we separate out into rooms, a lot of times now they don't have the typical basin anymore. Some places do, but a lot of times they have just these packaged wipes. I don't know if anybody's seen them. It's like 8 or 9 big towelettes, like wipes. I hate them. I don't feel that the patient gets clean with them.
Use this way.
It's nothing takes the place of soap and water, good old fashioned soap and water. That to me is more of a refreshing thing. I mean, I've seen people plop a bag and say, here, this is what you have to wash with. You know, we're not camping, you know, that we need to, you know, just use the moistened towelette. So if you can, if your facility has, you know, somewhere to have a basin, a small bar of soap, wash your patient, really wash your patient. Yes. Or, well, think about when you go in the shower first, right? You normally wash your hands and your face, but you always want to start at the top and kind of work your way down, right? With the extremities, well, we'll show you inside. We'll show you inside. All right, so let's break up. Who went first last week? Do you remember?
He went.
Okay, so you guys, your turn. We'll go over quick, some bathing, some bed making. Do you have your skills checklists, guys?
Yes.
Okay, good. If you have it. If you have it. I'm not gonna shoot you if you don't.
If you don't have it, then they'll have extra you can use.
Acquiring infection or the prevention of some, and also access for the
Hygiene.
hygiene.
Pressure injuries, right.
It's hygiene.
Remember, believe it or not, I mean, we know
It makes them
this-
feel good also.
Yeah, but we know that how important scientifically, evidence-based, why it's important to be bathed on a daily basis, right? Sure, skin stays intact, wash away bacteria, blah, blah, blah. Back in the day, okay, when Florence started everything, there was literally no such thing as infection control. People were not bathed, people did not change their clothes, even when they were healthy. Okay, there was very little sanitation, whether it was sanitation for the food or sanitation for personal health, which is probably why many people died very young back then, honestly speaking. Infection was rampant. So we bathe our patients, we provide hygienic care for them, we for a multitude of reasons. Besides making us feel good, keeping the body free of bacteria and germs, especially if they may have a wound, whether it's a surgical wound or a pressure wound. But we also provide hygienic care and use that time to focus on our patient because what? We're doing a skin assessment. We're seeing their skin, okay? So we'll see things that maybe other people didn't see before. So don't be so quick to turf that off to a CNA because you might see an old scar, you might see something starting to fester, and maybe the CNA is not knowledgeable enough to bring that to your attention, okay? So we do skin inspection, we do skin assessment. We can listen to the posterior side of the patient's lungs. What else can we do? We can teach our patient, right? Any interaction that we have with them, even something like bathing, we use it as an opportunity to teach and to assess and to reteach. So say, for example, the patient is a partial. What do I mean by a partial? Partial care.
You can partially,
They can do something, right? They can do something, okay? So what if I'm told in report my patient can wash his hands and his face? He only has the use of one arm. So he can wash his hands, his face, one arm, can do the other arm, maybe can do a little bit of the front, okay?
Giving the temper.
Yeah, so I'm gonna set him up, okay, I'm gonna give him everything he needs to do it, and I'm gonna watch him do it. Okay, I'm gonna watch him, I'm gonna assess him. Is he doing it correctly? Is he doing it sufficiently? Does he need any encouragement? Now, if he's doing a great job, of course I'm gonna tell him, you're doing an amazing job. That always pumps people up. Everybody likes to know that they're doing a good job, okay? And then I can use the time to educate him about something, all right? So even though you're doing something, you can always think about squeezing something else in, okay, that would benefit your patient. Then when the patient has had sufficient time to do what he needs to do, then you might help him with the rest, okay? So say if you're washing his arm for him that he can't reach, or both arms, you would start where? Start with the hand, start with the hand.
Fingers too.
Right, and then work your
Shoulder.
way up to the core, all right? Everything is always up to the core. Same with the legs. You can start the feet, long strokes, bringing it up to the body. Why am I doing that? I'm not scrubbing a frying pan, right? I'm not doing this.
Circulation.
Yeah, circulation, okay? I'm stimulating the peripheral circulation, okay? Stimulating that venous return. For the same reason, if you were to bathe and wash your patient and then had to put TED stockings or compression stockings on the patient before you get them out of bed, that would be the most opportune time to do it. You've washed them, you've dried them, no powder, no lotions that are gonna make things greasy, sticky, and then you're gonna put your compression stockings on to keep that venous promotion going, and then you're going to, with a peer, with your instructor, if your patient is able to, help them get out of bed. If they get out of bed and sit in the chair, then you can wash the bed. Not wash the bed, you can clean the bed. You can strip the bed and you can redo the whole bed, okay? You can wash the mattress if you needed to. Any questions about that? What about pericare or groin care? How do we approach that? It's part of care.
The females
You
have
can't
to be,
ignore it.
The females have to be cleaned differently from the men.
Yeah.
The females is front to back.
Yeah, absolutely. And I would always change the bucket for that. That tends to be the most bacterial prone area of the body, especially if the patient is a continental stool or feces. So I make sure I have lots of washcloths, plenty of nice soapy water, towels, gently, okay, always gently, but I'm not afraid to douse them and actually take the washcloth and let it bring like a small focused shower on their groin area to help wash it away as if they were in a shower, okay? Doesn't matter if the bed is wet because I'm gonna change that bed anyway, okay? But the idea is you want your patient to be clean. Now, in this picture, it's lovely, they have the basin, they have the water, they have everything set up. Many, many places are moving away from this, and they're moving to packaged wipes. I don't know if anybody has
Yeah.
ever seen them.
They have it inside.
Yeah, it's like, they warm them, they have like little warmers, and it's got like 8 or 9 wipes, and you kind of, that's not a bath. That's not
I
a
know.
bath. It's not a bath. I don't care what anybody says, okay? You would need like 500 of them to get somebody clean. So if you can find a bucket, you know, and some water, obviously that's the best way to do it. Okay, that's for like refreshing if you're camping in the woods, in the hills somewhere, and you have no facilities around, but it's not really for bathing. Why do we do it? I don't know. It costs more money, so I don't know why they're buying them, but that's just my little pet peeve. What about making a bed? Okay, any questions about making a bed? Now they have the fitted sheets in most places, so that's awesome. It makes our job so much easier. There are some instances where maybe the linen company didn't send enough fitted sheets, but they have a big pile of flat sheets. So sometimes we have to make a bed with the flat sheets. So there, did they show you, is that, okay, good. So at least you're able to, know that in a pinch, nurses, if we don't have the supply that we're used to, we're gonna figure out something else with a different supply, but we're still gonna accomplish the job that we have to do, and we're very, very good at that. So, that's the occupied and the unoccupied bed. How do you guys feel about, doing AM care on your patients? Do you think you're ready for that? Yeah? Okay. Maybe you can, see if your instructor will buddy you up this week perhaps and give you a patient that you could wash. What about also shower rooms and the shower facilities? Have you seen that in your place? Because some patients are on a shower schedule. They'll get bathed and freshened, but they get showers like twice a week or so, depending on their skin condition. And they wheel them in, and they have special, like rolling chairs that they can sit in. The bottom is cut out so they can make sure that they get them clean. What about diapers and chucks? Have you seen that?
Diapers, yes, but they didn't use chucks. I also was wondering if it would save, not saving shit, but not making them so soiled because they're gonna be washed together. That facility didn't use chucks.
No chucks?
No,
Okay.
but diapers, yes.
Diapers, yes, and some facilities opposite. Chucks, yes, diapers, no. Yeah. The problem with the adult diapers is if they're not changed frequently, it can harbor a lot of bacteria. And urine, if you sit in urine, think of a baby in a diaper rash, it's very, very caustic to the skin. So it depends on the site and the facility. I would say if your patient had an adult diaper on, that you check it very frequently. You don't check the skin frequently.
Because we change the diapers 2 hours.
Every time they soil it, what would you do with a baby? The same thing, right? You're constantly checking the baby's diaper if it needs to be changed for the same reason. The urine burns, and then you have broken skin, and then you have urine in that, and it really burns. Yeah. All right, but cleanliness, hygiene is very, very important. You will see when you go into the hospital setting. I have seen a very disturbing trend these past couple of years, that nurses are not interested in bathing their patient. They're not interested. Either the CNA will do it, or it doesn't get done. And I have asked patients, I said, we're gonna get washed up now, is that okay with you? And they're like, washed up? Nobody ever asked you if I wanted to get washed washed up. I wanna die when I hear something like that. And then there are facilities where they make it a part of the routine. Okay, so depending on the census of the floor, or even in your facilities, who gets washed in the night, who gets washed in the day. Usually they try and divide the division of labor so that it's fair for all of the shifts. And you'll see that when you move into a hospital as well. So a lot of the culture and the behavior is going to be driven by you, okay, and what you do as nurses when you are in the facility, okay? So please make sure that, at least in this instance, you're definitely the change agent, and you make sure that if your patients are able to get up and go to the sink in the bathroom, set them up and let them do their thing, okay? If they're able to take a shower, they're ambulatory, they can get up and walk, get the order from the provider that they can have shower room activity time. And you let them go in. Let them go in and take a shower. Like you said, you feel amazing. Everybody feels amazing when they're clean. So do that, okay? Do that for your patients. Sometimes it's the little things like this that really make a memorable stay and make you, in their eyes, to be an amazing nurse, okay? Because you thought of the little things, okay? Getting somebody washed, sitting out of bed, so they can see what's going on in the room, out in the hall, look at the window. It's a great thing, okay? Yes?
What if the nurse says that patient is able to do showering by itself,
Okay.
and the provider gives order,
Okay.
and patient falls in the bed? And
Well,
shower.
Usually, if you've seen the shower rooms and facilities,
It has a grid.
yeah, they have that like a little bench thing or something, okay? So we are not going to allow a patient to do something that we're not confident that they can do. Now, can accidents happen? Yeah, they can. But again, you have the order, you're covered for the order. But if I was even a little bit on the fence as to whether or not the patient can do it, no, I would do something else. I would simply, yeah.
I'd like to know because I work in a facility, and even if the person is bed bound, there's a
Yes.
time when that person will get a bath. So at some point in time, we have special chairs, special things. You're gonna take that person out, even in a hire,
Yeah,
and it's gonna still be under them, and you're gonna set up, because the chair can go back, it can go anywhere you want it, however make them comfortable. And that person is gonna get a bath, and you're gonna take them back up with the hire and put them back in their bed, and take them, dry them, take them out, put them back in their chair, have a good day.
Yeah.
They still get a bath, no matter what, they'll still get baths.
Well,
Maybe not be every day or often,
Right.
lightly they're gonna, but they're still gonna get taken to the shower at some point,
right.
yeah.
Right, exactly. And again, it depends on the facility, the schedule that they have, the types of patients that they have, the condition of the patient. Okay, so you take all of that into consideration. All right, this was not bad. Laugh, this was easy. Yes.
So when you say the patient can take a shower by themselves, so you don't have to accompany them, like,
Accompany them? Usually in a facility, it depends. If the shower room is down the hall, yeah, you can walk with them, sure.
I mean, but at the edge of taking the shower, they're by themselves.
Yeah. But you have the order, so that's okay. That's your activity order.
Mhm.
Don't do it without an activity order. All right, any other questions about what you saw inside? You good?
How many times for the patient is this?
How many times what?
The cleaning the patient,
Depends on the patient.
like in 24 hours, like once a day, or?
Depends
If
on what
the
you.
patient's always
So they have to go, whether it's.
Yeah. Yeah, if they're incontinent, you may be cleaning them very frequently. If they're not incontinent, then it could be a once a day thing. Like, how many
Right.
times do you take a shower? On a hot day, if you're sweaty, if you're working outside, you're probably gonna do it more than once, right? But if everything is okay and it's a routine day, yeah, you might, yeah. It depends on the situation, for sure. There's nothing written in stone. Remember, as a nurse, you have a lot of leeway using your nursing judgment, okay? Just because a patient hasn't ordered, bathe once a day, if they need it more than once a day, are you gonna do it more than once a day? Of course you are.
Do you need the order for that?
No.
Okay, to be, okay.
No, definitely not. If a patient soils themselves, you're gonna leave them in that, right? Definitely. Because what happens if somebody's skin breaks down? We own it. Good, bad, or indifferent, we own it. So sometimes it might be kind of like a progression of things, that maybe they had a skin breakdown or a pressure injury or a bed sore or decubiti, but we own it, okay? Especially if the patient came into us with intact skin and develops it, it's on us. That's why when a patient first comes into a facility, we have to do a total skin assessment. Because if the patient comes in with a skin injury or a breakdown or a skin tear or a bruise, whatever the case may be, we generally will take pictures of it, okay, as documentation that it didn't happen on our facility, but it happened before the patient came in. That documentation is key, okay? Key for the patient, key for us, key to prevent a lawsuit, for sure. Like I said, people will sue them and will things. All right, any other questions? What is that? Your degree works. Did everybody finish giving me their degree works? Yes? Thank you.
I'll give you all.
If you didn't, I will hunt you down. If you say yes you did and I don't have it, then you did not. All right.
Your lab sheets are here.
Thank you very much. All right, guys, stay tuned. I will be sending out an email later on in the week. Monday, we're supposed to be getting that test-taking strategy with ATI. So we need to find out, I need to find out where they're gonna put us for that seminar. It may not be our classroom. So just